Breast cancer screening has always been a contentious issue in so many ways, but you've been looking at one of the controversial areas, whether you screen women over 70. Can you tell me what you did? Because you've got a huge study in the Netherlands looking at this. What was it that you did?
In this study, we compared the screening performance, mammography screening performance between women from 50 to 69 and women from 70 to 75. Because in fact our program is the first national program that started to invite women up to 75 years. And the controversial issue was and still is that there is no trial evidence that mammography screening might be efficacious in this age group from 70 to 75.
Now, the data you've got is from 14 million screens, so it should be quite strong evidence. What did you get out of this?
What we found in this study is indeed a better screening performance in older women, but this is not astonishing because we expected that elderly women have more fatty breasts and that makes it easier to detect cancers. The risk of this is that negative side effects of mammography screening, such as overdiagnosed cancers, could be a consequence of screening in elderly women.
So you found overall then that screening is justified for the 70 to 75 age group, did you?
Yes, we did, and this is recently confirmed by the IARC in the newest handbook of cancer prevention for breast cancer screening that has to be published in one of these days. They recommend, or not recommend, but they think that there is sufficient evidence for effectiveness of screening in women from 70 to 74 years.
What about screening for women between 49 and 69 years of age? How much did you confirm that that brings benefit?
That not with this study, but we did, or our department did several studies on the impact on breast cancer mortality, and there we found a clearly related breast cancer mortality reduction, or clearly related to the introduction of the mammography screening program.
Right, that's very good to know. Now, you've therefore justified screening right up to the age of 75. What about beyond the age 75? What data do you have there?
There we have no data, but we think that it might be, or we would not recommend to screen beyond 75 years at the moment, because the risk of negative side effects will become larger, and the balance between harms and benefits will become less positive.
Overdiagnosis is an issue. What are the hazards of overdiagnosis? What do you come up against?
What we found is that 10% approximately in our program of screen-detected breast cancers might be overdiagnosed. But there's a lot of debate on this issue because several studies found much larger proportions of overdiagnosed cancer, but also there were also studies that found very, very limited proportion of overdiagnosed cancers. At the moment, some reviews show that approximately 10 to 15% of screen-detected breast cancers are overdiagnosed, and that is a reasonable estimation.
Now, with mammography screening, one of the balances you have to make is between the cost of screening and the way that money could have been spent otherwise, perhaps on treatment. Do you have any information on that?
No specific information, but of course this is more political discussion, I think. So just what are your priorities? And of course we think in the Netherlands that the program costs annually approximately 65 million euros, that this is still justified.
And you're not having to economize on treatments which might also extend life?
No, that's not threatening medical care, so that's completely outside of the medical care. We don't, of course, the screening itself does not impact enough. You need what's coming after the diagnostic. You need a treatment. If a treatment is not optimal, then you have to. It's not sure if you should then screen. So, of course, it's something that's related to each other.
What then are the bottom line messages coming out of your study on the effectiveness of mammographic screening, particularly looking at older women?
So we think that screening of women of 70 to 75 years has an impact on breast cancer mortality in terms of reduction of the breast cancer mortality, and we think even that this effect is not marginal. But at the moment we do not yet have estimates how large this effect is. So this is still an issue of ongoing studies.
So the bottom line message to cancer doctors for implementing this right now is what, very briefly?
No. So we would recommend screening women up to 75 years, but of course you need a high quality program and clearly design of how do you screen and how you can warrant the also treatment of what's coming after the screening.